Yeah. So what was interesting to me, Bree, is that we've got these like front of the house conversations where the legislature's sending over a plan, but then you have all these directors and former Governor Gutierrez going backdoor. Right, they're going directly to the governor and saying, "Hey, I want 20 million for GVB," and the governor's like, "Oh, here, I'll give you 20 million." So everyone's hitting her up. So it's going to be interesting to see how this meeting goes, and just how cooperative the governor is going to be. Right, because
Mm-hmm.
that's what it kind of comes down to. Is last with the CARES Act, she was basically like, "Nope, stay in your lane. This is my money. I'll determine how to spend it." Um,
Mm-hmm.
Yada yada. 7:05. So we're going to be talking about this, of course, probably for the whole week, if not the rest of the year. But let's head into the Zoom room where, from the Physicians Advisory Group, we have Dr. Hoa Nguyen standing by. Good morning, Doc. Unmute.
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 Okay. Hi, good morning. Everyone, Sabrina.
Good
Welcome back.
morning.
Yep.
Thank you.
She's still in quarantine, Doc.
It's a nice room, so enjoy the view.
Yeah, she's got a really nice room.
I've been enjoying all 6 days of it. Trust me.
Doc, I guess we'll just start from what we were talking about here in the studio. Was we were wondering if when you came on, you were going to say, because this is something you always have said over the last year, anytime there's a big holiday, let's wait 2 weeks and see what happens. Are we saying that for Mother's Day?
Yes, we're gonna see because there's a lot of gathering yesterday as we drive around, and we see how the case go. And the key here is half of our population have been vaccinated already. So, no, as we expect the case to go up, we just if the things work like supposed to be, the hospitalization will be still low. So that's what we want is that when people get sick, they won't be end up in the hospital. So that's what we were hoping for if the immunization program are working. I know we over 50% now, so I said half our population been vaccinated. So hopefully, like I said, the case will go up as people drop their guard down, but the hospitalization will stay below 10. That's the key.
Mm-hmm.
So we see if it works. It should work.
Right. When I was away and I was watching one of the press conferences that the governor had, she was mentioning, and maybe even it was Dr. Cabrera, they were talking about this new strategy for people that are arriving to Guam, where if you are fully vaccinated, that you wouldn't have to quarantine. And that was almost, I want to say, 2 weeks ago. And she was talking about implementing that in 2 weeks. So do you know where we are with rolling that out?
I think that we should still roll it out. I guess on the 15th or something like that, probably early next week. That fully vaccinated people can go home without quarantine, and the unvaccinated ones still have to be on quarantine for just like you are right now. The CDC really make that issue. I know it's pending on the state and territory to make the final decision, but I think that we should do that just to kind of incentivize people to get the vaccination. But we really have to reach the 75-80% marks here in the next 2 to 3 months.
Is that fully vaccinated with a negative PCR or just fully vaccinated come on in?
Fully vaccinated to come on in. Yeah, I think that the physician advisory group, along with the surgeons and everyone else, feel comfortable that the fully vaccinated don't need to have PCR to come in.
Okay.
So,
but
the rest will need to have the PCR to come in.
Mm-hmm. Doc, what's the latest discussion on the possibility of lowering the eligibility group and extending it further down to children? I know I read that I think it was about the Pfizer vaccine that is something that they're looking at. Is that something we're also looking at here?
Sabrina, we hope to kind of have a plan to roll out sometime next week or so. Once it's have been to have a final clearance that week, we'll start to vaccinate 12 and under. It's going to be a different campaign. I tell you, because in need of parents to be there to vaccinate. So we really have to think outside the box and start doing vaccination clinic, not during the working time, but from 5 to 9 or something. So that way the parents are off work and they can go and take their kid to go vaccinated. So we have to come up with something that make sure the parents are there with the child to get vaccinated, because it's different population, 12 to 17, they have to be with the parents.
Okay, so you're saying that yes, we are having those discussions, and there could be a possibility we may and make some announcements starting next week.
Yes, I know that they already plan to order more Pfizer, because that's Pfizer only. So I know that I plan to order more Pfizer than Moderna, just because of the 12 and to 12 to 17. I understand there's a lot of them, over 10,000 of them. So if we can reach half of them, it's help a lot.
Right.
Doc, what about the vaccination of the Department of Corrections? Do you have anything on that?
That's the DOC. They have their own clinic there, the staff, so they work with public health nurse to do that. So we don't get involved in that, but I know that they have their own clinic at DOC to do the vaccination. It's pretty easy to do. We are 5 months in. They should be self-sufficient.
Mm-hmm. Doc, we had Chima on last week, and he was talking about this new pilot program, which they actually kind of did a soft rollout on Friday at the rapid community testing at the Dededo Farmers Market, where you could come in and you could get your rapid test, and then you're given that option, right, if you want to get the vaccine. Have you heard anything on how that went?
Yeah, those gonna be rolling out a whole lot. Like I say, the last 20% or so is very hard to reach. Those are that kind of in the middle where they want the vaccine or they don't want the vaccine. So we have to make an extra effort and capture them where they are to kind of make it convenient for them. So the program for testing and vaccine together, that's another step that they try to get people to do. And I understand that it went fairly well. I don't know the number that how many they going to do that. They're also thinking of take the vaccine out to the industry as always. Just like on the private side, for AMC and JMC, we've been go out and vaccinate the industry, the bank, I know we did some for like companies like Triple J and Core Distributor. We go out, the company as a request to go out. And I know the Guard have a rapid response team that they divide up. So I think that's a certain member that they can go out to the public, to the industry, and vaccinate out in the industry as it get requested. So a little part like that would be very effective to try to get the last 20%. So you will see that there's a lot of little parts everywhere just to try to get people to get vaccinated to reach 80%. Like I said, the school is a big one. As we decrease the age, the percentage to reach 80% getting higher, because that's because the age limitation. So we really have to reach that that 80% mark. When we calculate 50%, we calculate based on adult, based on the time where the age limit, where the vaccine can be given. But now we add that 12 and below 16. We really increase that percentage. So that means there's more people out there who need to vaccinate it. So the percentage really going to be decreased as you decrease the age. We have to work extra to do that. So we have quite a way to go to get the rest of the population vaccinated. Again, get vaccinated, and I think Dr. Cabrera will agree that the more people get vaccinated, so you have to make sure that you protect yourself by getting vaccinated.
Doc, some of the previous conversations we've had in the past was this whole database on who got the vaccine, right? And so I think what I heard when I was away was that when they go forward with this new, if you're fully vaccinated, you won't have to go into quarantine. But the other side of that is that you have to prove that you're fully vaccinated. And they mentioned something about WebMD or Web you know what I'm talking about, right? Yeah. WebIZ. So yes. How do you do that? Do you ask public health for a printout? Do you have to email them? Because there's some people who are probably off island right now, and this might go into effect, and they can't get a printout. So how does this work?
Yeah, I know that they plan to put a person at the airport to verify your vaccine status. It's all the manual process that you do. I know that they are working some type of system to verify digitally through the computer, but privately, we're going to roll out a program, the QR code, to verify. I think that we're going to roll it out sometime, a soft rollout probably sometime the end of this week, and by early June, we're going to roll out a QR code program that is on your phone. You have a QR code you scan, and it verify your vaccination status and along with your last testing. So that way, when you go somewhere, you don't have to carry a piece of paper. You can apply that to go to a restaurant. You apply that to go travel. You apply that to some event that you fully vaccinated. So it makes it easy because you can lose a piece of paper, but you cannot lose your phone. So the QR code will be on your phone. It's all HIPAA compliant, so there's no private information there on the QR code program.
So can you kind of just explain that a little bit better? You said the QR code will provide proof that you've been vaccinated and your history of testing?
Yes.
COVID testing?
Yeah, it's the program we roll out basically based on your database on the WebIZ on the platform that basically pull out your type of vaccination, the date of vaccination, and what happens, just like you go to a restaurant, you have that little QR code that you scan it with any camera, on the iPhone, and they have your picture on it, so it will tell you, how many shots you have it, and also if you want to include it, be the last test that you have been done to see if it's negative or positive. It's a way that it's going to be like that for the next year or two. I think that nationwide, there's no national program. I know there's several programs that do that. Every state right now kind of verify themselves. There's nothing that nationally you can do. But at the same time, the program can also go through a clearinghouse to try to verify if you have a vaccination in California, you have a vaccination in Louisiana and Florida. There's a clearinghouse that you can go through to verify your shot. So the program will use clearinghouse to verify the shot at the office.
Is this a
But-
public health is going to be running this?
No, it's on private side. No, we public health. No, I'm not sure. They are working on their own ways, but no, we cannot wait for that. So on the private side, we can move a lot faster.
Okay, so what's public health going to do? It's just the email public health and ask them to send you a letter of verification that you were vaccinated?
Yeah, right now I think that on their part, they're gonna you can request a letter from public health for verification of your vaccination status, or they can have a person that at the airport to check on your web IC. But like I said, it's a very manual driven, and it's so we have to move forward to make it easier for our people to have the QR code. Thanks. A soft rollout will be the end of this week, early next week, and then the final rollout would be the beginning, first week of June.
Who's doing the soft rollout then? You said the private sector. So who are we talking about? Like GHRA or AMC?
We work. AMC will be working with GHRA to try to roll this thing out. It's benefit our island. So I think that, like I say, on the private side, we don't have to deal with procurement and everything like that. We can roll it out and make it so it's much faster way. By dealing with the government, with the own procurement, everything is too complicated. It might take weeks and months to do that. So it doesn't.
All right.
So it'd be convenient in your phone, Sabrina. We can probably the soft phone app. I can put it on you, so that way you can see how easy it is. Use this QR code.
Yeah, but see, I got vaccinated at the field house, so I didn't go to a private clinic. So would I be?
But so far, I know we have 4 people in the hospital, so the hospitalization is still low. So just keep asking people to make sure. The clearinghouse can go through the web IC, or we can pull data from web IC and make the QR code. Yeah.
Doc, we had a comment here. Even if vaccinated, you can still test positive and spread COVID. This is from Jesse. Wouldn't it make sense to still require people traveling to provide the negative test?
It doesn't matter where you get vaccinated. Yeah. The web IC, the local database should have your data there, so we can use it.
All right. Well, thank you, Dr. Hoa. When do you guys meet next?
To answer that question, when you're vaccinated, yes, you can still catch an infection. If you are asymptomatic, absolutely no symptom, you happen to get on Thursday. But let me finish that answer for that one, Sabrina. If you vaccinated, you're fully vaccinated, you can still catch the virus. But if you're asymptomatic and you get tested for travel, the likelihood that you will transmit the virus is very, very low. And that's the thing, is that the viral load is very low, that the likelihood you can give to somebody is low. The only time that we would test the fully vaccinated person if they are symptomatic. That means that they have cough, cold, congestion, that's when the viral load will be higher. But the majority of the fully vaccinated person will have low viral load.
Right.
So the risk that it gives to you is very, very low. They have
Doc,
no symptom at all.
your connection's terrible, but let me try and
Okay.
squeeze in this.
Again, we're going to go to any site to get the vaccine. Okay, Sabrina?
Yes, Doc, can you just answer this one real quick from Bev? For individuals who don't want to get vaccinated for their own personal reasons, how will this affect them